Like literally, this is what I thought. This is so dumb. I was like, did my arm just break off? Did I lose my bone?
In a way, kind of did break off. I'm Dr. Jaydee Romick, and I'm here with my guest, Brian Doak, the Vice President of George Fox Digital. So Brian's allowed me to share with him and share with you all some of his story as I was his physical therapist. So he came to me through George Fox Clinic and had a pretty significant injury that could have altered the course of his life.
Speaking of the day-to-day, I feel like I'm underdressed for this. You know, for those who are only listening, I guess you can see. I just thought I'd dress down. You look like cool doctor, though.
You know,
you're a cool doctor.
I would
1,000%.
I would rather be wearing sweatpants and a hoodie, curled up on this chair, legs crossed, just chilling, ponytail.
No, it's very professional.
Yeah.
But I'm your patient here.
Yeah.
Yeah. In the year 2011, 2012, I think actually 2012, when I had just lived here for not even a year, I was playing a softball game on behalf of George Fox University.
Oh no. And
this is going to get bad, just warning. And I was playing in the outfield, and it was the first pitch of the game. And the grass was wet. It was a beautiful night. This is in Newburgh at the fields up by Crater Elementary. Mm-hmm. And the guy hits the ball. And I'm like, hey, that ball is coming toward me. So I took a step forward. And then I was like, you're a former softball player, right?
I actually played center fielder.
You play?
Yeah,
okay.
Center fielder. So I get
Let's
you.
go.
I'm tracking right now.
So I'm like, hey, the ball's coming toward me. You know, sometimes when someone hits a rocket, you're like, you can't tell immediately how far it's going to be.
Yeah.
So this guy hits the ball and I take a step forward. I'm like, oh, I should go forward and catch the ball. Then I'm like, oh, shoot. Oh, no. This ball is going to go over my head. So I pivot and immediately, like lightning, Jaydee, like this is the fastest thing that ever happened in my life. Like lightning, I slipped in the grass and shot my left arm out to catch myself. And I blacked out for like just a second. And it was like I was struck by lightning. That's the image that I'm going with here. It was like lightning. Like I was struck by lightning. And I was almost like, I was like paralyzed. I had basically stuck my arm down. This is gruesome to think about. And I fell so hard on my left arm from my feet and at whatever angle that my shoulder not only dislocated, but it dislocated so hard that my humerus, is that the bone that goes into the shoulder?
The top bone of your arm, yep.
My humerus, based on the angle and the way I put my hand on the ground to catch myself, which was a very natural reaction, I guess, jammed up into my shoulder and severely fractured the inside of my shoulder socket, which is called a Hill-Sachs fracture.
Yes.
And I had no idea what happened to me. I was taken to the emergency room. I was white as a ghost. Everyone was like, what happened? I could feel that there was this mushy gap. Yeah. And I like literally, this is what I thought. This is so dumb. I was like, did my arm just break off? Did I lose my bone?
In a way. Kind of did break off, yeah.
So when I got to the emergency room, though, the first question they asked me that I remember, the person there, you know how they like triage you?
Yeah.
She goes, do you feel like you're about to faint? And I said, no. And then I totally did. And then
these are some details that I actually didn't get in your evaluation.
Yeah. And so the whole thing was just a disaster. They actually couldn't figure out what was even wrong with my arm.
Wow.
Because it was so severely dislocated. They were like, did you snap your arm off? You're making a face as though you think, why would they think that? Like, have they never seen a dislocation before? That's what I was thinking. So they take me in, the x-ray person, they were so sweet, but it's like, try to get your arm into the position to get it x-rayed when every centimeter of movement was like nearly making me pass out.
Excruciating, yeah.
Then they put me under. The people were so sweet. They were wonderful. They had to put me under with propofol, my first time I'd ever been under, which was actually kind of lovely in its own way.
It's a good time to take some of the pain away.
And anyway, they had trouble. They almost couldn't get it back in. Oh. They almost had to go into surgery to get it back in.
So that's a pretty severe dislocation.
And that's when that started. Yeah. Is that a normal way to dislocate? Is that the way that typically goes?
Yes, actually. Falling on an outstretched arm is a good way to either fracture a wrist or dislocate a shoulder. And
it's so natural though that you would shoot your arm up, but that's not what you should do.
It is.
No,
you I mean,
should you do that?
Yes. It doesn't guarantee dislocation every time, but it is a natural human reaction. And fractures and dislocations, they're a way of also protecting some of our more vital structures in our body. So as painful as they are,
Yeah.
it's better than puncturing a vital organ or something of the sort.
That makes a lot of sense. So I went through and then I went about 10 years and did nothing. And then during the pandemic, so the odds of redislocating, if anybody's out there vibing with this, like you've dislocated, it's about a 50-50 chance, they said, that you'll redislocate. I didn't do it for almost 10 years. I was like, this is healed. And it kind of got, that process was not the problem in a way. Mm-hmm. Every time I drove past, I want to pick up this story, but I want to ask you about this as a physical therapist.
Okay.
Every time I drove past the emergency room, still today, even just saying that phrase, I just cringe. I just cringe. My whole body cringes.
Yeah, that trauma is very real.
Does that happen to people?
All the time.
Yeah.
Driving past sites of accidents.
I felt kind of like a freak, like maybe I should get over it or something.
Absolutely not. That's a very real experience. People that go to the site of their accident or their injury, or really some can't go back to those sites because that, and I know we'll get into this, some is such a triggering and visceral response, because the course of your life and your life trajectory sometimes can be altered immensely by that moment. Some people define themselves when those injuries happen. Some people identify as victims when those moments happen. Right. And not saying there's anything wrong with that. Right. I'm just saying it is life altering.
It happens
when that stuff happens.
And you're saying it happens, and there's a variety of reactions a person could have.
Yeah.
Including feeling like, and I won't say it was the kind of thing like I couldn't function or I'd have to pull over my car.
Yeah.
But it's like looking at it, and even the word, like there's a word associated with it. It's the word fracture. Just that word fracture. Yeah. And the surgery that I'll tell you about, which you know about in a minute, was at a place called the Fracture Clinic. I just hated that word. Like
Orthopedic and Fracture Clinic.
Fracture Clinic. Yeah. Beaverton, shout out.
Yes.
What a great crew over there. Love them. But so I went like 9 years though. And just aside from the cringing at the ER, Providence ER in Newburgh, wonderful people, but I cringe when I see it. Yeah. Aside from that, I thought I was going to be fine. And then I redislocated it playing with my kids in the pool during the pandemic. And I was like, no. Ended up talking to a doctor about it who's a family friend. Yeah. And he was like, dude, if you're out backpacking like you like to do and you do this out in the backcountry, you could legit like end up dying because of something like this. You can't have that happen. Yeah. He's like, look, and he's a doctor. He's an anesthesiologist. He's been an ER doctor. He's like very bullish on the medical establishment. He's like, go in, just get the surgery. It's great. Yeah. And honestly, it kind of kicked something in me. I was like, I should ask. I should go. And they did all the MRIs, the X-rays. MRIs, that's another traumatizing experience.
Those things are scary.
Another example of them asking me, are you claustrophobic? No. I go in there. I'm like, I'm. This is really. I should not have opened my eyes.
Clicking.
Here's a tip. I'll give a tip for free, which is amateur tip.
For free.
You do an MRI. Just shut your eyes. Do not open your eyes in the MRI tube.
Take a nap.
Don't do it. Do not open your eyes. But I did. So they did that, and they were like, yeah, your labrum, which is this little like ring thing inside your shoulder that holds it together. That's a technical explanation for Jaydee. I'm just explaining it to her.
No, that's fine.
Was torn. And in fact, they were like, yeah, it was torn really badly. And they were like, yeah, you're a great candidate for surgery. But that was a decision right there. Do you even do the surgery? Because they're like, you could just keep going on and on. I even saw a YouTube video, which is, I bet, a #1 doctor recommended tactic is to watch some dude talk on YouTube and just say stuff with no medical expertise.
It's just as good as Dr. Google.
And he was like, don't do the surgery. Da, 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 da. And it really shook me, even though it had no kind of weight or bearing on my life. Right. Just, his voice versus, a doctor with all this stuff. I'm like, maybe I shouldn't. But I was honestly afraid to like revisit that whole thing because I thought it was fine. Anyway, I did the surgery.
It all depends on your life and what you want to do.
Yes.
I'll just say that.
Yeah,
YouTube guy had different priorities.
I mean, talk more about that though. Why? Like, why do people put out videos like that? Like, how do doctors feel about this whole establishment of like WebMD kind of to diagnose yourself?
Yeah, we all have different experiences, some not as severe. It's everybody we're unique. We have different experience. We have different demands. You going backpacking, you playing with your kids, you doing the athletic things that you like to do. Right. Having a stable shoulder is a bigger implication for what you want to do and what your life looks like. Right. Someone who may never use that shoulder again. We look at it with ACL surgeries too. Players that are done with their sport may opt to not do ACL surgery and just get super strong, get really stable and supported by their knee. It just depends on your life. So reading Reddit, YouTube, Dr. Google, they don't have your life in mind and they don't know you.
Right. Right. That makes a lot of sense. It shows you how, I guess, personal and specialized all these kind of decisions have to be. But it's not something that one would want to make simply in isolation and in fear, like just on the internet. Like I saw that and it did affect me. It made me second guess the question of whether to have surgery. But I needed to talk to like more people, right, and figure that out.
Yeah.
They did the surgery and he said it was, quote, way worse than they thought it was.
And see, sometimes this is a reason to go in and do it.
Well, that
your body is different.
Honestly, I felt so validated when they said that. I was so happy that he said that, even though it was bad.
Yeah.
Because it made me think, it was good. Because he said basically one more time, and I would have been looking at a very different kind of surgery where they cut. This was like the kind where they go in with the. I actually, by the way, I watched a video of that type of surgery. Mm-hmm. I think that was a mistake.
Yeah,
because I saw it.
It's not for the faint of heart.
It was after I got it. I watched it, and I was like, I wish I hadn't seen that.
Orthopedic surgeries can be very violent.
Okay, why? There was like a lot of like water and fluid flying around. Why were they doing that?
You'd have to probably talk to a surgeon about it.
I don't even want to see
it's probably
that.
saline to clear the area in a sterile and sanitary way.
And it looked like it had this feeling. This is something that actually came up during our physical therapy. I know that's the story we're kind of getting to here. We're building toward this, okay? This is hard to talk about.
Build.
But it's like, I remember you talking about the way that when you do physical therapy, it's also about emotions and body and life. It's not just like for surgeons who do these surgeries, it's like they're in a surgery factory.
Right.
And yes, they see you as a human being and they're trying, but in a sense, they see you as a piece of meat, on a table. And those are my words, not your words. But like, that's the way they see it. And they have to, right? Because that's what they do. But watching the surgery, it made me very much feel like it was an alien procedure and that I was a piece of meat that they were just working on. And so, but he said it was way worse. He said 75% of it was like not even intact.
Yeah.
And that made me feel much better. But that's when the physical therapy started. I'd never done physical therapy before. I'd had actually bad experiences with physical therapy, not interpersonally, but I just felt like, I don't know how else to put this. I just felt like it didn't work.
Yeah.
But I never had something serious enough where there was something at stake.
Yeah.
And the first time I came in to do physical therapy with you, I was afraid. I was deeply afraid. Like, I felt really vulnerable and I felt really afraid. Like, is that a normal way to feel after a surgery to come into something like that?
Yeah. I could tell you talked quite a bit and I could tell there were nerves and it is a really normal thing for sure. You have to
I'm glad we don't have a video of that experience.
No,
I would be too cringy.
It was also great because I see it all the time. And it's where people come in with this uncertainty. And I will say not everybody comes in to PT. And I think that is a huge bummer because if they've had a negative experience in the past with anything, it shapes the way they see things. So I commend you for coming in, even though you had a previous experience that was negative, because movement is the thing that gets you better. And I see so often when people come in at their lowest, they're seeing this new injury as a defining moment in their lives.
Right.
And you can either go one of two directions. You can reinvent the athlete that you want to be in life, and you can work on that definition of yourself, or you can become a victim to your circumstance and allow it to control you and kind of put you in a prison of, I used to be this and now I can't do it anymore. And I see those two paths often, and the ones that choose to come to PT and follow through and put in the work get better. And they have this kind of elation of, I couldn't do this 2 weeks ago. I couldn't do this 2 months ago. They trust the process. They put in the work and they're consistent. And it puts them on an infinitely, exponentially better trajectory for life than the latter, or the former rather, that takes you into this spiral of victimhood and this despair of, I don't have joy in my life anymore.
Well, what's weird to me about like having a major surgery, and it could be obviously for anybody, listening, you would have, people have had all kinds of surgeries that have the same effect,
Yeah.
And the surgery I had was actually a pretty common surgery too, whatever it's technically called, to repair the torn labrum and stabilize the shoulder and repair the fracture on the inside, whatever they do. But like the first night at home, I was just despondent. Like, you can't sleep.
It's the worst. The first night after surgery is
there's
unbearable.
And I know that there's this whole kind of societal thing about like chronic pain, like people who just feel pain, but it wasn't quite chronic pain like this. It was something I knew what it was, but there's this sense, even if you know what the pain is, I would think even much weirder and worse if you can't figure out what it is. There's this odd sense in the bed there at night where I'm like, this is just my life now.
Yeah.
Like I will never improve. Like, and it's dark, you know, my dog actually came up and jumped on the bed with me. We don't allow our dog in the bed, but I slept in a spare bedroom.
Yeah.
Because I didn't want to bother my wife and all this kind of stuff. And so we let the dog up on that bed, and it was like so comforting that the dog was there. That the dog actually helps tremendously. It's the only time he's actually like helped me in any way. That was his one moment of like actually helping me was, but like, you know, so to even have something like that in your life was pretty amazing. But just the darkness of that feeling. I have a question for you. Maybe this is like just off.
Yeah.
Coming in that first time, or even just like having an injury and trying that first little micro step to recover. I think one thing that was really weird for me, given what the fracture was and the feeling and all that stuff, and just having the surgery, I think one of the weirdest things is like you come into a physical therapist and even having someone touch you, like touch the arm. And it made me think about you as a professional, just like there have to be cases like I did not feel good about you like holding the arm. Like there are things that you did, right? Like very gentle things at first, which became much more, you know, stretchy and serious things as those months went by.
Yeah.
But like right away, it's almost like, how as a medical health professional, do you even approach that issue of like touch or get that kind of permission in a sense? Because it's actually like very sensitive. And some people, there's almost like an animal sense where you want to be like,
protect.
You protect the thing.
Yeah.
And you'd be like, you know, relax the arm. I'm holding the arm, relax the arm. And it's like, no, I'm not going to relax the arm. Right.
Yeah. There's an immense amount of trust that has to be built. And it is a scary thing. Your first visit, or maybe even your second visit, you're with a stranger who is now in control of one of the most sensitive, like painful appendages on your body, where you're like, I can't move this arm on my own. It hurts.
Yeah.
Don't touch it.
Right.
It's a natural protective mechanism. It's what our nervous system does. You're on a heightened alert. And the whole, if not one of the main goals of PT, is to lessen that nervous system alarm system. It's made to protect us. It's made to put us on alert. But if we keep it on alert, which is sometimes what happens with chronic pain, is you have this heightened sense of protection or this trauma or this experience that keeps that nervous system alarm system so high that movement helps lower that. Touch can help with that. But it comes with developing a lot of trust and not injuring your patient on the first day. So you have to be really mindful of the techniques you use to initiate movement, let the swelling and the normal inflammation that comes after surgery decrease. Pharmaceuticals can help initially, but letting that process and trusting that process while just gaining some movement can be so healing.
One of my rebellions against the surgery is I didn't take any of the narcotics.
Atta babe.
I was just like,
that's impressive.
I was just like, I'm not doing it.
Yeah.
Can I ask you, I know as a medical professional, you can't like share like specific cases, but like, have you ever had a case, or what would you hypothetically do in a case if you have a patient who just like, they're just like, they really, that protection is so strong. They just are like, no.
Yeah.
They can't do it. Because I could see, I wasn't like that. I submitted to it, but I could see how one could feel that way.
Yeah, I don't have that happen too often. There are folks with chronic pain that, this is going to sound really harsh, if people aren't ready to move, if they're not willing to allow what needs to happen in therapy, which is movement a lot of the time, that's their choice.
Right.
And that sucks as a healthcare provider, because you know in a way what's best for people. Just like anybody in any profession, whether it's financial management, just different things, like unless people are really invested in what their goals are and what they want to do, you can't convince them, no matter whatever convincing, until they're ready. You can't force them to do anything they don't want to do.
Right.
And so that's kind of the short answer, is you just can't until they're ready.
Yeah.
There are, of course, motivational interviewing techniques. You can kind of get to the bottom of, you know, what's keeping them, or what's their prison that they're putting themselves in, so that you can help meet them where they are and get them to move in ways that they're safe and that they feel comfortable and confident. But if they are absolutely unwilling, there's not much you can do.
That sounds like a thing that has a greater life app. That's true probably for so many things in our lives. It reminds me of like the way that Alcoholics Anonymous talks about things, like in the issue of like rock bottom and wanting to change and stuff like that. I know that's a part of their lore. The AA lore is like that same kind of thing. Yeah, so absolutely. It applies to lots of stuff, I guess. So what was the driving factor for you? Why did you decide to show up to PT even though you had a bad experience, and what got you out of it? I think it, you know, in a way, to have something that was that traumatic. I mean, my arm is in a sling. Yeah. And I'm like, I think as one approaches middle age, I think I'm either firmly in the beginning of middle age or starting that, kind of process of being the typical middle age, midlife crisis male kind of thing. I think it's a deeply emotional thing because I had this surgery right on the cusp of that time of my life last year.
Yeah.
And it just became like this whole thing about like, I'm looking at the second half of my life and I'm thinking, how do I want to live the second half of my life physically?
It's amazing.
How do I want to exercise? Do I want to do these like really long, like 30 plus, 40 plus mile backpacking trips? I wanted to, as you know, like part of the process, which doesn't seem like it involves the shoulder directly, but like I wanted to do longer distance trail running, like 25Ks and 50Ks, which is like 15 to 30 miles, kind of things, even ultra marathon type distances. And it was like, I guess I had to look at it and be like, are those goals that I want to simply give up on and say, I'm not going to do that anymore, I guess? Or is it the kind of thing where, and I had started this whole like kind of health revolution in myself. I started eating very differently in 2019 and I started exercising in a different way. And it kind of sparked me, maybe it was like turning 40 and just those feelings that come with like 40, or maybe now it's 50, where people, there's a certain number that makes you feel like, oh no, I have to treat my body in a certain way. And so I think there was a sense like I knew that it was severe enough. I think I had to face something severe enough in my life, not just like back pain, where maybe one day it was fine, but the next day it was bad. Okay, I'll go to a physical therapist. I don't know if that really helped.
Yeah.
As opposed to being like, I was trapped, like I felt like there was no way out of this. I still have young kids. And the idea of not being able to do things with them that I wanted to do, of not being able to be on that long family hike and carry their backpack, which I almost always end up doing at some point during the hike, you know? And and just not be, and I think in some ways, maybe like this feeling of youth and going into middle age, it was like there were ideas about myself I guess I felt not ready to give up on.
Yeah.
And I don't ever want to give up on in a sense, although even based on something you said earlier, there's this sense where you have to redefine yourself.
Yeah.
Like, what if I can't do the same things? Like, one of my early goals I said is I will know I've recovered if I can do pull-ups again.
Yep.
Because I got into pull-ups. I really love pull-ups. I felt like pull-ups were really great. And I wanted, and you said that it would probably take a year. And I was like, yeah, that feels like too long.
Yeah.
And I didn't want to, and you know what? I started being able to do them again almost exactly 1 year. It was like October. The surgery was November 16th, 2021. And it was almost like in late October. Yeah. I texted you. I was like, I did pull-ups.
Yeah.
So to see that, I did not anticipate that it was going to be that long though. But I felt inspired to continue with it precisely because I could see movement. The shoulder felt this way this week, but then the next time it felt this way.
Right.
And some of the things really worked. And it was like you said, motion, like actually, I think that's counterintuitive though. And that's something I learned from you is like, something hurts, don't move it.
Yeah.
Okay, something hurts. Yes, the wrong kind of movement could obviously be bad.
Yeah.
Or too much. But to actually move something that hurts, a little bit counterintuitive, but I thought that's a great process.
It's amazing. And if there was one message I had for people as a physical therapist, it would be, if you have pain, I mean, granted, I don't want you, like you have your acute injury, you fall, dislocate your shoulder, just move, you'll feel better. No, it has to be the right context.
Yeah.
If you have pain or lingering something,
do
something about it so that you can move again. Mm-hmm. Don't become defined by this new body that you have, because the body adapts, the body responds to load, it responds to the forces that are on it throughout the day.
Yeah.
If you put good forces through your body and you start moving again, the changes won't be just felt, but it'll be kind of this, what's the word I'm looking for? This your emotions, like your mental state, everything will be elevated with it. Like it's almost like this transcendence. I think that's the word I'm looking for.
Wow.
And this out of body experience where you'll become something you didn't think you could again.
Oh my gosh. And it's like elation.
Yes.
When you get back to that. Yeah. Transcendence. That's the way emotions, I appreciated not only on our first appointment where I was obviously nervous, but just throughout, even just listening to someone talk. I would imagine like back in the 1950s or whenever physical therapy was invented, there probably wasn't a big emphasis on like listening to people.
No.
Or letting your entire experience be a part of that.
Absolutely.
And I think I'm a very gut level kind of person, a very emotional kind of person. And I think even in ways that I don't understand. Let me tell you about a weird experience I had even recently that maybe you could reflect on in terms of that emotional thing. So how do I tell this story? Like a couple months ago, I had this experience where, there were just things going on in my life that I felt very upset about. And I went on this long walk with my wife, walking our dog. And I just had, I don't know how else to explain it, except to say it was just like a low level mental breakdown. I was just so upset. I was very viscerally upset about legitimate things, real things. And I was appreciative to have someone to talk to and just to kind of work through this. And I'm still, processing some things about all this stuff. But one thing that my wife brought up that was super fascinating that I totally didn't realize, this like breakdown I'm describing, it occurred on the exact 1-year anniversary of the surgery.
Oh, wow.
On November 16th. And she was like, I wonder if that plays some role just in that heightened emotional state.
Yeah.
On that exact day. A day that was really important to me as a transition in my body and the surgery. And I thought about it and I was like, it was like almost like I didn't want to take away from the experience I was having by attributing it to feeling some kind of weird memory of this other thing. But then again, I thought, well, it's also kind of honoring to the experience too, to realize that, to have like these anniversaries, like, and I could imagine if somebody had heart surgery or something much more serious, to have like that anniversary of that thing, especially if it was something where you were rushed to a hospital, say with a heart problem. And, the day that comes up again, just like the grief or trauma that comes on a day when a loved one had passed away or something.
Yeah.
You remember that.
Yeah.
And even if you don't remember it, maybe in your mind, it's kind of almost like mystical, but I wondered like, did my body just like somehow remember that?
Yeah.
Like that actual day and that feeling, like, is that a common experience to have? Or like what kind of, I don't know, talk about that.
It is. It's funny. You bring up, somebody who had a heart incident that's more serious than mine, or, whatever the case, you can't compare severity. You can't compare one injury to another because those are significant in your life. There's a book, and I recommend it to a lot of people. It's called The Body Keeps a Score.
Oh yeah.
And it does talk about this.
It's been a New York Times bestseller for lots of weeks during the pandemic in particular. People were into it.
It's really great. And so many people can relate to the story of something in your life going wrong, whether it's a divorce, a loss of a loved one, a loss of an ability, or a moment in your life where you thought everything is different now and something monumental has changed who you are. That date, that environment, where you are, the time of year, it is valid. So I'm not surprised that happened. Of course, having other things can contribute to that. If you have other significant moments in your life, it sounds like there's some other things going on for you too.
Yeah, clearly real things, but like to add that weight of it and to realize that it corresponded with that.
Right.
It's like, that can't play no role at all.
I don't think it's...
It has to play some role.
Right. I don't think it's coincidence. And I firmly believe that the body does keep a score. And I think we do have this emotional, traumatic experience that can trigger that spot in our brain to when this moment happened a year ago or 2 years ago. The grieving process, the rehab process, the recovery process looks so different for everybody. Yeah. And if that 1 year mark was so monumental, or if that 2 year mark was so monumental for you, there's a lot of weight surrounding it.
Right.
There's a lot of buildup. There's a lot of mental energy focused on that. So I absolutely think that it can pertain to that. And I do see it with other patients.
I think for me, in summary, it was the first time in my life really when I felt like my body seriously broke down.
Yeah.
And it had just never broken down. I'd been an athlete in 4 sports all throughout high school, and not really so much in college, but I kept that kind of ethos alive. And even with the running and stuff, I'm still trying to like live into that. And it was the first time of just like a serious breakdown. And so those come with thoughts of just death and change. And I imagine too, like one of the deep questions, if you have chronic pain or some major injury and it's like you can't get over it, it's like you wonder in like very deep emotional ways, like, am I ever even going to be happy again?
Yeah.
Will I even be able to do the things I used to do that I associate with happiness?
Absolutely.
Because it's not just like happiness, like this Zen state inside your mind. It's this total picture of your life.
Right. Like, are you happy in your life right now? So what keeps you there? Like, what keeps you trying, like day after day, trying to get back to that homeostasis or that place of peace?
I wonder if in some ways it's not a totally mature process. Like in a sense, it's still this like male macho, like get back to where I was and like be what I was. And now like last year I ran 2 25K races.
Yes,
it was really fun. And now I'm trying to do 3 50Ks and 20. So it's like, you can see I'm doing this thing of like, I'm going to pretend like this never happened. I'm going to even do more.
Bury it. Yeah.
I'm going to bury it deeper inside of me. But eventually even that, right? Like that's going to break down. And even training for these 50Ks, I'm realizing like, there'll be a time when I will run my last run. It might not be when I'm 43 or 53 or 73, but it will happen. I thought that just the other day, like, and I didn't feel sad, but I thought, yeah, that's like every day of your life, you're like one step closer to that. Right.
Wow.
And that's true for everybody. And so I think there's still something that has to come in my life that I'm just not there yet, in terms of like not trying to fight it by even more ridiculous things, but just accepting, like you say, this idea of redefining. And I imagine for major athletes who, you know, like we saw nationally, there was a football player in the Bills who had that heart failure on the field,
Yeah.
Damar Hamlin. And, you know, like regardless of whether he returns to football, like he's going to have to redefine his entire life.
Yeah.
Especially if he doesn't go back to football, right? Like life
Right.
becomes bigger and about something else. And so I think I'm just on that journey as a middle-aged person to like think, okay, my kids are going to grow up. My marriage will be different. I can't have all the things I used to have. I can't even do all the things I used to do.
Yeah.
Just in general, not even with the shoulder. The shoulder is almost like fully recovered, I would say, like 99%.
Yeah.
But it'll be something else, right?
What's that bigger thing for you?
I think it's probably, yeah, I don't know. I'm still very much on the journey. I'm exploring. I think it might be, you know, rather than like being on this like achievement treadmill in life, it might be like just bigger questions of meaning, or realizing that like finding some way to actually give back with a focus on other people, not just building. I mean, this is the mythology of the midlife crisis, is that one kind of gets certain skills and then you build, acquire. I get the house, I get the wife, I get the kids, I get the stuff.
Right.
And then the breakdown is this moment where you're like, I can't keep building anymore. And so when people do very traditional midlife crisis things, grow the ponytail and get the motorcycle and try to run 350K races for no reason, like that kind of stuff. It's like this avoidance of this thing that one's life has to take. And the Christian author, Richard Rohr, has a lot of writing on this, about how one has to become a kind of holy fool and take a wisdom descent at that point into life. And so I know whether I wanted to or not, at some point, what comes next has to be some kind of descent, not just ascent and clawing upward, but some kind of descent which involves wisdom, and not like just physical strength, but a different kind of strength. And also involves going down into like some deeper, darker places of life, and also being that support for other people.
That's amazing.
Too, yeah.
So being that support for other people right now, what are a few pieces of encouragement you have, tips for the journey? And you can do 3, you can do 2. It doesn't really matter. But what's bubbling up for you to tell people right now?
Yeah, I mean, in terms of like just medical stuff, and in terms of our work that we did together, which was so meaningful. I mean, you were just so good. I think even the kind of practical stuff that can get overlooked, like, you know, we all want like a mystical, beautiful path toward wholeness, and not the fact like you have to show up for the appointment. And, you know, you had homework for me between the times, which sometimes I didn't do it to the full extent, but every time I didn't, I felt guilty, and I tried the next time to come back. And I think it's always about going from wherever you are, which was very much what you encouraged during that healing process. Is like, you gotta go from where you are. And so I think that, you know, I had to really ask myself, like, what is it that I'm trying to do, and what do I want? And then actually aligning. So in other words, maybe like aligning my actual values with my actions. Sometimes we say we have values, and then the things we do are totally opposite our values that we state. So it's like, well, was I wrong about my values, or do I need to get my actions in line? But it's at some point those things have to come in line. So to organize your actions and your values around that process of healing, like to actually do it. Number one. And number 2, right there. I think that those are the things. And then also, like, I think there has to be some kind of support network around people, like emotionally, whether that's mental health therapy, whether that's all kinds of things. I had some free mental health therapy built into my physical therapy, as you can hear.
Great.
But, you know, I can get that through other ways too, because it is something that goes on. And there does have to be another journey that goes alongside the rehab physical one. And it's like a wisdom journey about how to become a different kind of person. And that could be true if I was 25 and had a major surgery, or 55 or whatever, or 75. One becomes a different person. So I think a certain openness to that task, and finding other people to journey with along the way, because to do it alone, I think, is just a little too lonely.
We need people. Wow. Thank you so much for sharing, Brian. This was an incredible, reconnection of, a time we had rehab together. But I think
good memories.
The lessons are going to carry the people that need to hear it so far.
Thank you for being my physical therapist.
Anytime and all the time. And go see a PT if you need to get moving again.